Hello, I am urologist Omer Erdamakaya. Today, I will briefly talk about premature ejaculation drugs and their characteristics. Premature ejaculation drugs are divided into two. One is taken orally and the other is a spray or cream-type treatment applied locally to the penis. Almost all of the tablets taken orally constitute antidepressants, namely depression drugs, but are known to prolong ejaculation time as a side effect. We have been using these drugs as a treatment for premature ejaculation for a very long time. The most well-known of these are drugs with active ingredients such as sertraline, paroxetine, and duloxetine. As for the drugs, we've been using sertraline and paroxetine for a long time. As I said, these drugs are produced for depression. They contain too many tablets. Using them 6 hours before intercourse is sufficient for the treatment of premature ejaculation. But if the person has a high frequency of intercourse and has intercourse every day, he can use these drugs every day. Apart from that, duloxetine has been developed. It is one of the antidepressant drugs that have been indicated for premature ejaculation. And there are only 3 tablets in a package. It is a very expensive drug and it is sufficient to take it 2 hours before the intercourse. Alcohol should not be taken after using the drug because it can cause a very serious decrease in blood pressure. If you ask my own clinical opinion about whether these drugs are helpful or useless, I can say that these drugs are not curative. The benefit is seen when using these drugs. When is it beneficial? If the patient is well chosen, he can benefit from 60% to 80%. At this point, it is necessary to add a note as follows: these drugs should definitely be taken in consultation with the doctor. Because if there is a premature ejaculation due to erectile dysfunction, these drugs make the patient worse. In other words, if the patient's erection power has decreased and has premature ejaculation due to that, he gets worse when he uses these drugs. If the patient's erection is good, he gets very good answers thanks to the drugs. Do these drugs provide permanent treatment? No, these drugs do not provide permanent treatment. After the effect of the drug has passed, we can say that the patient returns to his old self. Apart from this, there are also substances applied locally to the penis. These are local anesthetic agents. They are applied locally. They can be put in gel or among water-based liquids. Water-based ones are in spray type. Oil-based ones are in the gel type. These are applied by rubbing it to the head of the penis 10 to 15 minutes beforehand. I prefer water-based ones. Why is that? Because it is easy to wipe since the person needs to clean the head of the penis well before intercourse. The reason for this is to prevent it from contacting to his partner. In this way, the pleasure of the other partner does not decrease. Gel ones not only contaminate the sheets but also have a higher chance of affecting the opposite side. Water-based ones are easy to wipe and practical to use. These also do not provide a permanent treatment but are safe to use because it is both very practical and inexpensive. In addition, there is the hyaluronic acid filler that we apply to the head of the penis in our own clinic. It is applied to enlarge the head of the penis. It also somewhat desensitizes the glans penis and prevents premature ejaculation. Their success rate is very high. It is around 80%. The procedure can be performed under local anesthesia in 15 minutes and the patient can go home on the same day. It is a simple and frequently applied procedure in the world. The success rate is also high. Thanks for listening. Best regards.